The United States has a healthcare delivery system unlike any other in the world. Most developed countries have national health insurance programs run by the government and financed through general taxes. Also in these countries, most of the citizens are entitled to receive healthcare services. This is not the case in the United States, since all Americans are not covered by health insurance. As the slide suggests, the U.S. healthcare delivery system is very complex, very expensive, and has many providers and insurances. Healthcare in the United States continues to be impacted by increasing costs, resulting in reviews for appropriateness and admissions for inpatients and medical necessity requirements to justify a hospital stay. As an example, patients having surgery may have their pre-admission testing performed on an outpatient basis to save costs. This is usually done a few days before surgery. This slide lists many of the providers of healthcare in our system. We always tend to mention the physicians, but there is a large group of medical providers that work along physicians to help deliver care. Both physician assistants, or PAs as they're commonly called, and nurse practitioners work alongside physicians. There are other medical professionals such as physical therapists, occupational therapists, speech therapists, just to name a few. Healthcare providers can be classified into two broad categories: direct care providers and non-clinical allied health professionals. Physicians, PAs, and nurses are examples of providers that give direct patient care. In all states, these professionals must have a license and are regulated by a state board. Direct care providers also are the principal users of the medical record. They continuously document the care provided to a patient. Clinical allied health professionals are those such as respiratory therapists, radiology technicians, or phlebotomists. They are also direct care providers and perform tests, provide treatment, or provide therapy to patients based on the orders of physicians. Non-clinical allied health professionals are health information management professionals, just as an example. They do not provide direct clinical care to a patient, but are an integral part of the healthcare team. There are also many types of healthcare settings available to patients. There are clinics and diagnostic centers for quick evaluations and tests, up to complex hospitals that deliver specialized care to patients. Some facilities are for services that require inpatient hospitalization, and some are strictly for outpatient surgeries or treatment. Ambulatory care is the same as outpatient care. These type facilities provide services for patients that do not need to stay overnight in a hospital. A physician's office is considered an ambulatory care facility as well, just as an emergency room also is. They do not have patients that stay overnight. From an emergency room, a patient can be admitted into a hospital for inpatient services. The inpatient services cannot be given in an emergency room. As you can imagine, ambulatory care facilities make up the majority of the different types of healthcare facilities. Acute care facilities are typically hospitals, but not always. They are for patients who have an injury or illness that requires them to be in a hospital overnight, if not for several days or more. Some specialty hospitals, such as rehabilitation hospitals, do not accept acute care patients for a short period of time. Hospitals are organized with separate departments within the hospital. For example, an emergency room, radiological services or radiology, intensive care, laboratory, patient registration or admissions, and health information management or medical records. Long-term care facilities provide care to patients who need inpatient services, but not as much as those given in an acute care facility. Patients are typically in a long-term care facility for more than 30 days. Examples of long-term care facilities include skilled nursing facilities and nursing homes. Home health allows a patient to remain in their home while health care is brought to them. Home health agencies provides this type of care. Nurses, physical therapists, or other healthcare providers can come into a patient's home on a regular basis to provide services based on physician's orders. Depending on a patient's needs, there are facilities that handle each need of the patient. A list is provided on this slide, as on the previous slide. To determine which category is best for the patient, you must first look at what services are medically necessary for the patient. This helps the physicians and the caregivers to determine the best location for patient care. When you think of continuum of care, think of continued care. Healthcare services are no longer confined to just the hospital and physician's office, where many services are delivered. The Joint Commission once defined continuum of care as matching an individual's ongoing needs with the appropriate level and type of medical, psychological, health, or social care of service. This definition still holds true. Continuum of care is the complete range of programs and services given to a patient. There are 3 levels of continuum of care discussed on the next slide. The table on this slide shows the 3 levels as primary, secondary, and tertiary. Primary is the more routine care patients receive in their physician's office. Sick visits, immunizations, and follow-up visits are a few examples of primary care. Secondary care is often those services a physician may refer their patients out for, such as x-rays or diagnostic studies. A referral to an orthopedic surgeon for a broken bone would be another example of secondary care, as an example. Tertiary care is the most complex level of care. These types of services are normally performed at trauma or teaching hospitals. Intensive care and burn units fall under tertiary care. Having an electronic health record or computerized health record is the goal of every healthcare facility. In fact, most laboratories are entirely electronic and have been for many years. An electronic health record, or EHR, is the storage of a patient's medical records on a computer system, as well as the functional benefits derived from having an EHR. Some of the functional benefits are to capture data at the point of care, integrate data from multiple sources, and provide decision support. If a healthcare facility is not entirely electronic or entirely paper in terms of its patient's records, It is what we call on a hybrid system. A hybrid system is just what it suggests, both electronic and paper. This is not a bad state to be in at all. In fact, healthcare organizations that are mostly paper must move into a hybrid state to get to an EHR. This is not an easy process. It takes a long time of planning and implementation to get there. The slide suggests roadblocks that must be overcome to get toward an EHR. Handwritten documentation, such as orders and prescriptions. Outdated systems that are going to be very expensive to replace. Information kept across different locations in different forms, and the high cost of introducing the new technology. There was also a push by various healthcare organizations for patients to be responsible for their own health information. Consumers of healthcare, or patients, now have the options of various personal health records, or PHRs, on the online market. Some are free, while some have small fees associated with them. The purpose of a PHR is for the consumer to be able to maintain their own health records and health information. There are online services that allow patients to log on to a secure website to create and update their records or files. The patient controls who has the right to access the information, and they can add or remove permission for clinicians they might visit to view the online record. The main advantage of a PHR is that it is available everywhere there is internet service. When patients are traveling and a health issue arises, they will have access to their information. The main disadvantage is that patients are entering their own information. The information must be accurate being entered into the system. This last slide illustrates regional health information organizations, or RHIOs. RHIOs encourage the exchange of a patient's health information across medical practices and facilities that are owned by different entities for the care of the patient. Imagine visiting your doctor's office and your doctor admitting you to the hospital for inpatient services. Your doctor can electronically send your admission orders and the necessary paperwork over to the hospital. When you arrive at the hospital, all of your information is already entered into their system. You get to skip filling out loads of paperwork, and you can go straight to the floor, to the bed assigned to you. Even after discharge from the hospital, if you're transferred to another facility or a specialty facility, all of your information from your hospital stay can be electronically sent to the receiving facility. It is this seamless sharing of information that is the goal of the RHIOs. If you have any questions about the information contained in this presentation, please contact your instructor or refer to your textbook for more information. Thank you.